The overriding sensation in Downham is of a low expectation. People don't think that they're going to achieve anything, so they don't try. It's an area that's been historically neglected by all the powers that be. So we're trying to change that round. I'm Helen Tasfield, I'm GP at Oakview Family Practice in Downham, and I'm also Clinical Director of Sevenfields Primary Care Network, and I also chair a little local charity called Downham Nutrition Partnership. Over the last couple of years it's been really apparent how important social engagement is, community engagement is to people's health, and we saw an opportunity in this project to enable the community to find out what it wanted for itself and hopefully build into it projects that we can support and we can get funding for that actually is what the people want to make a difference for themselves.
Most regeneration programs undervalue the existing community's wisdom and ability to create solutions. We believe residents' insight should be at the heart of regenerating their neighbourhood. My name is Tim Ashodi. I'm a founding member of Downham Community Land Trust. We value our community's knowledge by training and employing Downham residents as community health researchers. We are building a long-term partnership between local residents, GPs and our social research experts to co-create evidence-based solutions which build upon the social capital of the area.
At Social Life, our work is about understanding how people's day-to-day experience of their neighbourhood is shaped by the built environment. We work in different ways, and we see how change affects the social life and well-being of local communities. For this project, we trained and worked with a team of local researchers to understand what supports people's health in Downham in South East London. My name is Nicola, and I'm one of the founders of Social Life. Understanding the everyday experiences of residents is critical in building detailed portraits of an area. And this is easiest when people with lived experience of the place are involved and play a central role in designing and carrying out research.
I enjoy finding out new bits about Downham from locals. The research has allowed me to go to new places in the neighbourhood, talk to more people and get to know the research team I work with, and hope to work with them again in the future.
For me, this project has been a great opportunity to learn from the expertise of Downham residents. Thanks to their insight into the area, we're hoping to start an interesting discussion about the everyday factors that support well-being in the community.
It's been good to be out with the research team. It's not always been easy because I've had health issues, but I've learned new things about research and health in Downham.
By involving residents in all the stages of the research process, we've been supporting residents to develop their skills, improve their confidence, and really gain new insight into the area's strengths as well as the challenges that Downham is experiencing. My name is Olympia. I'm a program lead at Social Life. We need to change the way traditional research and funding agencies understand rigor and ethics in place-based research. We need new approaches that value multiple points of view and that put partnership building at the very heart of the research process.
This pilot is important because it creates income for local people, making sure that money stays in our community. The community researchers gain more confidence and they become advocates for their neighbours' needs.
We've got great facilities, we've got amazing parks which have nothing in them at the moment. We want to develop the parks, we want to see what people want in them. Do they want to grow things? Do they want more exercise? Do they want businesses? So just really improving people's quality of life and hopefully get local people to get work, start learning things, sharing their skills. If we can provide the oil that makes that happen, it could be amazing.
After 4 months' work, talking to over 200 people in Downham, we've analysed our interviews and we have 3 main findings. First is about local assets. Parks and green spaces are really important to Downham people. 23 different green spaces were named as places that the people had visited over the last month. Parks are seen as good, affordable places for families and children. They're seen to support physical health and well-being.
But local people want to see better amenities and facilities in parks, such as outdoor gyms, but with toilets nearby, water fountains, a lot more community events. There's a lack of investment in provision for children, toddlers and the youth. It was also noted that people want things like paddling pools, playgrounds, hanging bars and so on.
An important local concern is about affordability. People interviewed said that local amenities have to be low cost, ideally free for people who can't afford to pay. They need to be accessible to people with different needs, thinking about people with reduced mobility, people who work and making sure it's available around their hours, and thinking about childcare provision.
The third finding is what's missing and what's needed. Local people want to see more community activities and more cultural venues. Certain groups were underserved at the moment. Those groups include young children, the youth, older people and vulnerable groups, especially those experiencing mental health issues and social isolation. Another key challenge is there's a lack of information about what's currently available in the area. Many local people didn't know where to access this information, and some suggested that the local GPs would be a good place to provide it.
We hope that this community research pilot becomes the starting point for a wider project. We want to develop a set of community indicators for Downham, co-designed and co-created with local residents. These would bring together the insights from our community research with what we can learn from official data and from local agencies. This new approach could be used to guide health provision, regeneration spending and housing development in the area.